Let's turn that down a little bit. I don't want to be hurting anybody's ears.
There you go.
Here on Drum Talk TV's original series, Plugged into Hearing Health with doctors Michelle Schechter and Dr. Eric Sandler. Welcome. How are you guys?
We're good. How are you?
Doing well. Thank you.
Good. Same here. Well, first, before I unload on you and ask some questions and report back on a couple of things, because something just occurred to me, something huge, actually. But folks watching, tell us where you're watching from and let us know if you have hearing issues or hearing impairment issues or impaired hearing issues or issues where your hearing's impaired and you can't hear very well because of loud music. Maybe you're a musician. Maybe you just go to gigs and watch loud music. Maybe you go to restaurants where the music's really loud, or clubs, or maybe you have an industrial job with equipment. We can talk about that here as well, because a jackhammer actually has a really good rhythm to it. So anything goes. If you have questions for the doctors, I'll be checking the comments. I'll relay them. But there's like three main areas I want to cover, and everyone else is welcome to ask whatever you want. I just realized that, and I have no clue what's changed, but I just realized my tinnitus it's not totally absent, but I've just noticed and realized I've not noticed it that much. I don't know. Could that simply have to do with, I've been in a really good frame of mind lately. I've been doing some work on myself. Could that have something to do with it? Less stress? Could it be dietary? Or is it that I'm so impaired with my hearing, I don't even hear my tinnitus anymore? Is that possible?
I don't know about the last one. But tinnitus is absolutely affected by your lifestyle, your diet, your sleep habits, your stress levels. Tinnitus is such a phenomenon that we don't even know. Anything under the sun can affect it. But keeping your stress levels at a minimum is probably your best way to keep your tinnitus at a minimum, or at least as good as it can get for it. So if you've been in a really good frame of mind, that makes sense that your tinnitus has abated a bit.
Wow, that is so exciting. I still have the same things going on that would normally cause the stress, but it's how we all react or respond to it, right? And I fell down this rabbit hole about 2 or 3 weeks ago, a video with the recitals of a gentleman named Alan Watts, who was a philosopher and a psychologist back in the day, lived from 1915 to 1973, about how to just deal with being. You know, some of it's Taoist, some of it's Buddhist, some of it's this, that, and the other thing. And it's really resonated with me. And I've been able to remain extremely calm in some situations that would normally just like make me worry and stuff. Now, you mentioned sleep, Dr. Michelle, and the thing about my sleep, when I sleep really well. However, there's been a lot of days in the last same time period where I'll fall asleep relatively early for me. Really early for me is like 9 o'clock to 10:30 p.m. But then I'll wake up at 2 a.m. just bang with hive mind, and I'll read to try to go back to sleep. And if I can't, I get up and I'll sit here, I'll work until maybe 5 or 7 in the morning. So another 3 or 5 hours I'm up. And then I go to sleep for a couple more hours and then start the day again. So my sleep's been good. It's just been in weird intervals and stuff. I wonder if that change has anything to do with it. I don't know. But the quality of sleep's been good.
We should all be so lucky.
Yeah. I've been pretty good with sleep over the years. I don't sleep much, but I sleep well. Weird dreams, but I sleep well. Yeah, go ahead.
As she was saying, with tinnitus, there are so many external factors that can exacerbate tinnitus. And when you are in a better mindset, whatever the underlying cause of that is, whether you're doing work mentally to feel in a better mindset, whether you're eating more healthy, whether you're getting the sleep you need, whatever that looks like, whether your relationships are feeling stronger, whatever it may be, when you're overall in a better headspace, a lot of times what we find is, hey, that tinnitus might be there, but you're less reactive to it. And when you're less reactive to it, that keeps the stress level low, that keeps it from getting worse. So, as we've said here before, one thing we tell our patients is if it's working for you and you can continue it, continue.
That's
So,
great.
if your mindset is, we think, is the underlying cause of that tinnitus abating, keep working on that mindset and try and hold that place you're in.
That's great. Thanks. Who else out there? And come on, folks, don't be shy. This is almost a dumb question for coming from a channel that focuses on the world of drumming. There's got to be other people out there that have ringing in the ears and other hearing issues. So I would love to know. Oh, here's Doug Scott chiming in from Camarillo, California. Not only did I live in Ventura for 14 years, Doug, but I worked at the what used to be the Camarillo Mental Health Hospital. Not when it was active, but I helped with some of the cleanup before they turned it into the college. Beautiful area, and DW Drums is located right up the road in Oxnard. But, if you have issues, chime in. Another question I had was last time we did the show together, I mentioned that when I sleep with my right side on the pillow, and if I pull my head up, I can feel my ear like almost come sort of unplugged. And you mentioned that maybe I have a lot of wax buildup. I haven't visited that. Can you both talk about how to recognize or when to get checked that we do have wax buildup? And then, well, what do we do about it? Because one of the things we also talked about was that the ear wicking with a candle isn't really a legit thing. How can I take care of this, and how can other people make sure that they don't have too much wax buildup?
So what we would generally recommend is that you not take care of it, that you see a professional to take care of it. The question I would flip around to you is, do you know how long your ear canal is?
I don't, but can I take a guess?
Sure.
Who knows how long their ear canal is?
Is that all the way from here to where it meets the throat?
To your eardrum, from the opening to your eardrum.
Oh, I'm going to say maybe not even a quarter inch, 3/8 at the most.
So you have about 2.5 centimeters.
Oh, wow.
That's an average.
So there's a liability there waiting to happen.
So for people who mess around with wax, first of all, if you're doing it yourself, you're not really seeing what you're doing. And yes, there are some over-the-counter tools that I know are advertised and marketed to people to remove their own wax, but that is risky. We do recommend you see a professional, whether it's your physician, whether it's an urgent care, whether it's an audiologist in the states that audiologists will remove wax. That's really going to be the safest way to go about it. If you feel there's a change in your hearing, it very well could be wax, but it warrants seeing a professional, because any sort of what we call a sudden hearing loss, a sudden change in your hearing, the most benign cause would be a wax impaction, a plug of wax. But there can be medical emergencies that cause that you really do need to get it checked out.
Interesting. So don't use an old-fashioned wire coat hanger, number
Definitely
one.
not.
Definitely not.
Number two, and I hope she hears this because hopefully you'll say no, my wife should not be slapping me hard on this side, hoping the wax will just fly out,
It
right?
depends on what you did. But no.
Okay. That's interesting. And what is the process involved with doing it properly with a medical professional? What do they do? Is it basically with tools, or do they put a solution in there first? Like, quite honestly, at the risk of you yelling at me, my wife has put drops of peroxide in my ear.
That's a reasonable thing to do, because it doesn't take out the wax itself, but it does soften it, so that if the wax is very hard, then it can at least soften it so that the professional can take it out using tools, or they can spritz in, they can kind of flush it out using some instruments. Or if the wax is soft enough, it can help it slide out naturally.
Nice. Okay. And it's non-invasive technically, right?
Exactly. So you're not going to be hurting your eardrum. You're not going to be, there's no risk of poking anything, just a couple drops. Right. We usually recommend it at night, though, so that it has time to get absorbed and help the wax loosen while you're lying down.
Great. And then when you do go into the office, they do use specialized tools to literally extract it?
That's basically it.
Great. They
Yeah.
do that through the nose, right? No, I'm kidding.
Depends if they don't like you, they might. What you'll
Funny.
typically encounter is they'll use a curette, which is like a little scraper to go in there and remove the wax. Or, as Michelle was saying, the wax can be flushed out, usually into like a little basin that'll sit below the ear. Those are the two most common ways you'll encounter having it removed. The importance of softening it is that wax that's been sitting in the canal for a long time, that's dried out, that's kind of bound to the skin, can be painful to remove. So the softer that wax is, the easier it can come out and be flushed out.
And you know what? I'm remembering that she has done that a few times where she'll do the peroxide and then she has the basin that I hold. She has a thing that looks like what you would use on a young infant for mucus, and she'd squirt water in to flush it and it would come out. And that's okay to do at home on your own as long as you're not sticking something in there.
I hesitate to recommend any of those home remedies because you don't know if you happen to use too much pressure and that water is directed right at the eardrum. Could you cause an injury? That's where I really think you're best off leaving it to the professional, because while vast majority of times people are not causing damage, if you do, damage can be permanent and cause permanent hearing loss if you physically damage the structures of the ear. Great.
Thanks for that. And John Costello is saying, I have ringing in my right ear with a sad face. And he says he's watching from Minnesota. So I'll ask a first couple questions, and then I want to hand it to both of you to do the rest of the the questioning. So John, I'm curious, are you a musician? And if you are, when you play, what is on your right side? Are you a drummer and it's that cymbal you use? Are you a guitar player and there's an amp there, or the drummer is there and it's the cymbals? Like, do you know what that's from? And I find that interesting that it's strictly one ear. To me, that would mean there's something in that direction causing it, probably, right? But not always.
So it depends. Whenever we hear about something occurring on one side of the body and not the other, that gets our radar up. We never like to be alarmist. There oftentimes can be a benign cause of like, hey, you're a musician and that the hi-hat is on your right side and you're constantly getting with that. Yeah, that could certainly have an effect. Or where are you oriented on stage? And is your right ear consistently getting blasted more than your left? Do you wear in-ear monitors and take your right ear out? Those are all reasons why musicians could potentially have what we call an asymmetric hearing loss, where the hearing is different one side to the other, or have asymmetric tinnitus, where you have ringing on one side and not the other, or worse on one side than the other. However, whenever we encounter a situation like that, even if we think there is a simple explanation, we do recommend you get evaluated by a professional to make sure there's not some sort of significant underlying cause that needs to be addressed. Okay, great. And what line of questions would you have for John or someone else with that condition that replies with this, that they're not a musician and that none of those are the causes?
I'd be curious what it sounds like to them. Does it sound anything like it's pulsing in the ear, or is it ringing? Is it buzzing, humming? Because even how it sounds could have some sort of effect on what's going on, or at least can help us guide the recommendation. Is anything specific triggering it? Is there any pattern that they notice? Is it constant? Is it waking them up at night? Those are all things that would probably be the initial questions we'd want to know.
And maybe
and history of noise exposure. What kind, if they are not a musician,
right,
what other noise have they encountered? Because there are some times where I'll have a patient and I don't understand where their ringing might be coming from or the origin. And then at the end of the appointment, they'll say, oh, I was involved in construction for 25 years. And that can suddenly shed some light.
Right. Now, his reply is interesting. I'll put it on the screen. And John, thank you so much, because you're helping other people as well. He says, got really bad after a Stephen Wilson concert a few years ago, and he was wearing earplugs. So one thing that we do know with noise exposure, and I think we've touched on this in the past, there's something called a temporary threshold shift.
there are tiny little cells within the ear that receive the vibration of sound. Those cells convert the vibration, the sound wave, into an electrical energy that transmits along the auditory nerve that the brain can decipher. Now, when you have a lot of loud sound going into the ear, those cells can get temporarily damaged. When those cells get temporarily damaged, you may feel like when you walk out of a loud concert that your ears are clogged or that your ear is ringing. It could be from damage to those cells. And so I see on the screen we're saying it's sort of pulsing. Pulsing tinnitus, if it sounds like your heartbeat, is something that you want to get checked out. There are some causes of it that we're not so concerned about or that are more benign, like congestion of the ear, but then it could also be an indication of vascular issues going on. And that's definitely something when we hear pulsating tinnitus, which is why that was the first thing Michelle asked after you asking what else would you want to know. We always want to know if there's a pulsation to it. Is it in line with your heartbeat? And if
I've
it is,
heard that before myself, where I hear my
yeah.
heartbeat in my ear. Wow, that's scary.
Yeah, so that's something we typically, when that's what the tinnitus is described as, we recommend that getting evaluated by an ear, nose, and throat doctor.
Wow, interesting. There you go, John. Thanks again. And if you have any other questions, let me know in the comments. Anybody else who wants to chime in with something they have or anything like that, you're absolutely more than welcome to. These two experts will answer. I'm just the conduit here. Nice. The other thing I wanted to bring up was,
and actually, let me just jump in real quick.
Sure, please.
One thing I want to be clear on when it comes to the topics we're talking about with ears and hearing, the majority of explanations for these problems, whether it's tinnitus in one ear, hearing loss in one ear, the majority of the explanations for those things are not problematic. However,
interesting.
Whenever we encounter those, they do warrant professional evaluation because there are instances where those things might be your first indicator of something really serious that is addressable. So when we encounter people who have those symptoms, or I should say when people have those symptoms, come see an audiologist, come see an ear, nose, and throat doctor, even go see your general practitioner. But ears are very, very specialized that you're probably best seeing somebody who deals with them all day long.
Great. Yeah, that makes total sense. Thanks for that. Michelle has something that I'm going to pull up on screen. There we go. Hearing aids. One of the things I was going to mention was, as you may remember, I had hearing aids and one of my dogs got them and chewed them up. Thankfully, he didn't swallow them. And I haven't gotten new ones. How does someone, there's, like any other product, there's so many things out there. How does somebody shop for something like that without being, an expert and knowing, oh, this is just cheap stuff that won't work well, or even if we don't want all the special extra bells and whistles, no pun intended, that come with them, just basic amplification, which is what I need. How do we shop and know what we're doing and without blowing through 4 things and spending all that money before we find the right one? What are some rules of thumb, or are there any?
I think the best thing to start off by is asking questions. Ask questions to either your doctor, to whoever you're seeing to look into hearing aids. I would suggest seeing a doctor over somebody that just sells hearing aids because they do have the expertise to hopefully program it correctly for you. They have a lot of tools in their skill set to program them to maximize what you can get out of them. So I highly encourage people to go see a doctor, to see an audiologist for it. And then it's all about asking questions. What kind of hearing aid do you think would be the best for me? What do you think makes sense based on my lifestyle? What makes sense based on the places where I want to be hearing better, based on my movement in my hands? Can I get this hearing aid in my ear? Because not everybody has the best finger movement, and it requires actually putting something in the ear that's pretty delicate, that's pretty fragile and small. So asking all the questions rather than even doing your own research online, because everything online is going to say that it's the best product and it's going to solve all of your needs. But hopefully somebody who is doing this correctly, who's doing this properly, is going to be realistic with you.
Yeah, that's interesting. Do you have a preference of type, or does it really just come down to everything you just said as far as lifestyle, dexterity? And with that, do you recognize what the most popular configuration seems to be out of those three?
The best type of hearing aid is the one that the person is going to wear. So
Makes sense.
believe it or not, I think there's a common misconception, Eric can chime in about this too, that the ones that are to the right, the in the ear ones, that is the best kind because they're the least visible, as opposed to something over the ear where something is showing on the outside.
Mhm.
But the in the ear ones are kind of chunky and they do stick out. They're not invisible, and the ones that are over the ear tend to blend in with hair or skin, and they are more discreet than people think. So, and the ones that are over the ear with a little tip that goes inside the receiver in the ear ones
Yeah.
tend to have a little bit more of a natural sound because they're not fully plugging up your ear. They're not something that's entirely clogging you up. So it
I
sounds
like
a little bit more natural. It gives you more of a sense of, or less boominess to your voice, to the world around you. So we tend to recommend to err more on that side, but there are people that are adamant that they want ones that go in the ear, and there are many people that that's applicable for. Eric, why don't you chime in on that?
Yeah, and going back to the first part of that question when it comes to shopping around,
Mm-hmm.
what I think is most important for an individual to shop for is the provider. When it comes to hearing healthcare, you're going to have follow-up appointments. You're going to establish a relationship with that healthcare provider. You want to make sure you trust them, you value your opinion, you value their opinion, and you're comfortable with them. Because if any of those aspects of the process are undermined for you, the likelihood of success is going to be greatly reduced. Now, these days, there are over-the-counter hearing aids, and some of them can have pretty advanced technology. For people who have more mild hearing loss, they can be a very viable option. The one thing that we do tell people is that if you try something from what I would call an alternative delivery route, whether it's over the counter, whether you're ordering something online, is that if something doesn't work, don't think hearing aids don't work. It might be that the
Right.
route you chose didn't work for you, and you may be best served working with a professional. So other hearing healthcare professionals won't be happy that I'm saying this, but we are not necessarily needed in every case, but we're needed in a lot of cases.
Mm-hmm.
And if something doesn't work right, find a provider that you trust and work with them to resolve your problem. There are a lot of options. There's a lot of excellent technology these days. It's not the hockey sticks that your grandparents used to wear. It's really very advanced technology.
I want to come back to hearing aids in a moment. I want to show this other comment by Neil McMillan. I'd like to show the comments when we can so they don't jump off and then they miss the answer.
Sure.
From the Great White North, Hosers? So he says, Northern Saskatchewan here. I know I've got some nasty tinnitus. Some days are worse than others. It affects both ears, possibly worse on the left side, monitor on the left when I play drums. And now I have gone to the audio tech. Most of the time I just deal with it, but there are days where it just drives me nuts. I can relate. I had that for a while, so bad that it was like overpowering. They should probably not walk to a hearing professional, right?
So actually, I'm in addressing that question, I'm going to tie it into that hearing aid conversation.
Okay, great.
For the majority or a lot of patients that have tinnitus, they also have underlying hearing loss. The tinnitus does not cause the hearing loss. The hearing loss led to the tinnitus. So what we see is a positive side effect of amplification of hearing aids is relief of tinnitus for a lot of people. So if you have tinnitus that's really problematic and you have hearing loss, try hearing aids. It is not true that there is nothing that can be done for tinnitus. There absolutely are options. So hearing aids may be a first step to help with that. If it's really driving somebody nuts and it is affecting your mental health and your overall well-being, that's something that you need to see a provider for. We certainly encounter instances where tinnitus has a significant adverse effect on mental health. We always refer to psychology or psychiatry in those cases because it's not something that we're going to wait and see on. That's something that we absolutely want to address.
Right. Thanks for that. And looking at these models, mine were in ear, but what you said about those totally makes sense as opposed to not completely plugging up your ear. I think the one on the top left, the receiver in ear, is what I see most common, people wearing behind their ear, often silver ones. And I'm at the point where like I'm completely unaffected by this in the vanity space. Like I don't care. I'll get purple ones. I don't care if people see them. I'm not ashamed that I need hearing aids. Like I just want to hear. You know what I mean? I don't really care about that stuff. But I know that for some people they do, and it's important to them. They got a certain image and, maybe they're young. So why am I 34 and needing hearing aids? Well, you were in the military and you're a drummer and you play gigs full time. So, so I'm not one that's intimidated by that, I guess is the word. There's another. Oh, Neil also says I grabbed my phone instead of the mouse to click on this. I've done over the ear and it helps when it gets bad. Is that the only time you wear it, Neil? I'm just curious. But that's really interesting.
Mm-hmm.
And is it the one that I referred to that is the model you may see people go for the most?
Which specific model?
The top left.
Yeah, the receiver in the ear is probably 75+% of the hearing aid market.
That's a lot. And what's the price range of those?
Really depends. Depends on where you go. Depends on how advanced the computer chip inside is. It so varies. You can find them online for $9.99.
Oh
wow! And they probably go up to 3,000-4,000. I'm guessing.
Yep. Yeah, and actually,
higher.
What's interesting these days with the in-the-ear hearing aids, it used to be that you would see them in different skin tone shades, and then the sizes got smaller and smaller over time. They wanted them to be discreet. Now a lot of them that are made actually look more like Beats and other Bluetooth earbuds. And I think the hearing aid manufacturers are thinking that that's a little bit of a more mainstream device look, so they can get away with hearing aids looking like that these days. So
now that's smart, going into it from a cultural aspect, if you will, a lifestyle aspect. Yeah. I must admit, when you first said Beats, I pictured a bloated purple root, thinking, well, that's an interesting shape for it. Again, I'm serious. Neil also says in Saskatchewan here, there's a program for children to catch hearing loss at early ages. That would have worked for me, but it was after I was in that early age that I did all the self-inflicted damage, being a drummer and a loud music listener who never wore hearing protection. Never.
Now you get to be a spokesperson to help other people do it.
Exactly. It is important because it affects everyone around you. My wife has gotten to the point where we just call each other now in the house here, because if I'm more than 5 feet away, I can't hear her. And it's just, and
well, actually, let me clarify. Is it that you can't hear her or you don't understand what she's saying?
Sometimes it's both, but it is more of a muffled. When I can hear her crystal clearly, most of the time I can't understand what she's saying. That's another story. But yeah, often like I hear, but the volume's really low and it's muffled and it's like way in the background. And that's if I'm from, see where the Hanukkah bush is back there? That's probably 8 feet away.
Mhm.
If she's talking, and she tends to be a low talker unless she's mad, she's from the Bronx, then it's hard for me. I'm like, can you speak up? Or sometimes she'll talk and her volume will, she trails off, and I'm like, what'd you say after XYZ? So it's a combination of those things, but it's mostly that the volume's low and it's intelligible, it's muffled.
Mhm.
Yeah. Neil says it's called Spark, supported by the Saskatchewan Elks. That's great. That's a great program. And I think, Michelle, there's another slide there.
Yes. So I wanted to give a little bit of insight into the
Wow.
in-the-ear ones come in lots of sizes.
Wow.
So they
Yeah.
have ones, if you look at the bottom right, that's kind of the largest size that they have. And then they have ones that go smaller and smaller until you have ones that go invisible in the canal, which is the one all the way on the bottom left. Is it invisible? It's pretty deep in there, but the
How do you get it
detriment,
out?
you can, there is a tiny piece of plastic. It's a little bit muffled on this screen, but there is a tiny piece of plastic that you can use it's a little string that you use to move
I've
it out.
seen those. Yeah.
So the detriment of actually ones that go smaller and smaller is that you lose phone connectivity. So one cool feature of hearing aids is that most of them can connect to your cell phone for streaming, for phone calls. You can control the volume of them, that if you want to make them louder or lower. But if you make them so small, there's not enough physical room in the hearing aids for all that stuff to fit in.
Right.
So
the right
you're
drivers
getting,
to get the
you're
quality
getting
and the volume, right?
exactly. So you're
Yeah.
getting very basic technology. The noise reduction abilities in that hearing aid are pretty minimal because there's no physical room to put all that stuff. So it's a trade-off. There are people that say they just want whatever is the smallest, and there are those that are willing to go a little bit larger in order to get some of the extra features. And it's all going to be about what you're going to wear at the end of the day.
I love that, because my wife Enja says you should get the one that has everything you just said: the Bluetooth, the phone calls, listening to music, noise reduction, all that stuff. And in my head, I'm seeing like place columns being filled up in the dollar signs, but it's your hearing, it's important.
Right.
And as I mentioned before, I almost don't care what it looks like. I just want to hear better. Like, what
I
am I
wish
going to do
everybody
with
had the
this
same
video?
mentality.
Yeah, it'd be nice if we could all just put that other stuff aside. Neil says the muffled effect I really get, and it drives my wife crazy. That's hilarious. Yeah, and going back to that, what I was saying, folks, is that it really does affect everybody around you, because you're always having to repeat yourself, or they're having to, like, sometimes my wife, when she talks louder, she's not just talking louder, the tone changes and she sounds mad, like she's yelling at me, but she's not. And it's just to get more volume. And then it just changes the dynamic of the conversation. And sometimes, like, someone will say something, because I've been alerted to this, someone will say something to people and they'll say, right, Dan, or Dan, what do you think of that? And I'm like, just doing whatever. I don't even hear it. And maybe I'm lost in thought, partly that with the hearing impairment. And it'll drive other people nuts more than it drives you nuts, because they're probably getting more of the effect of it than those with the hearing loss are. I'm guessing. I've sort of learned
a lot of
along the way.
times.
We have a lot of family members come in that are more frustrated and more heartbroken for the patient than the patient is.
They're dragging them in
Yeah.
by the ear, literally. Neil says, laugh out loud. Okay, for an old guy like me, I'm glad I don't have these features. That's funny. I don't know how old you are, Neil. I consider myself not an old guy, but an older guy. In fact, when Michelle talked about the little plastic wire, I'm thinking, yeah, for me, that would just look like another old man ear hair. I'll be 63 in a few months. So I'm right. Wow, it's going to be January soon, so April. But I don't think of myself as old,
When it comes to the technology of hearing aids, a lot of the technology works in the backgrounds where you don't actually have to interact with the device. The way you can interact with your phone, or giving you flexibility with changes, you don't have to do those things, but they're available to you if you want them.
Interesting.
For those that are a little more intimidated by technology, or just kind of want to be left alone, the devices can work on their own, but they also are enabled to work with other technology.
Interesting. And there you go. What would be, and I know with so many products and so many ranges, like he said, what would be the median price range for something with a decent amount of the features, like that most people that you see most people go for? Maybe they don't want or need everything, but they'll pay for X, Y, Z, and it's more than just the basic. At least Bluetooth and, let's say, noise reduction at good levels.
So I'll jump in on this one. That's a hard question to answer because for the majority of our patients who are coming to us, our practice happens to be like long established, very referral heavy. So people kind of know what they're paying before they come in the door. So for us, the vast majority of patients are in the $5,000 to $6,000 range for a set of hearing aids. However, there are less expensive options. Some people go to big box stores, some people do over the counter, and in a lot of ways, those people are kind of weeded out before they come to us because they're not seeking us out to begin with. So
Right.
our price point is going to be higher than some other hearing aid opportunities that are out there.
That makes sense. Yeah, my first pair, actually, I did have two pair. My first pair was, I think, $100.
$100. Wow.
Yeah, and they worked well as far as simply amplification. Like, I think I mentioned that one day I was like, my wife started talking. Wait, shh. Do you hear that? She says, hear what? I said, it's like, she said, stand over here. I said, oh my gosh, it's louder. She said, that's called our water heater. Like I was hearing things I didn't hear. And then I went for a drive and the road noise was so loud, so it was either on or off. I mean, it had volume, but still it didn't have like noise canceling, all that. Then I had another pair, and that's the pair the dog ate, that were, I think, $230. And they were, I couldn't tell the difference. And then after about 3 months, the charger stopped working, and I was like, I'm just gonna get better ones. And then I knew we were going to do this. I've put it off so I can get some great advice like everybody else is getting. But what do we have here? The ones on the left are like what I seem to see a lot of people wearing.
Yes. So one of the reasons I included this picture in there is that people think that these days you still have to change the batteries, and battery changing can be very annoying and tedious. You have to change the batteries once a week. They now come in these child-proof packs that we find we're accidentally scraping ourselves trying to get these things open. It's so difficult to open those battery packs. So having it be rechargeable saves a lot of time and effort, and it just makes it convenient. You charge your phone, you charge your hearing aids. So the ones on the left are the ones that are the over-the-ear hearing aids that sit nicely in the charger. And they've recently come out with ones that go in the ear that also are rechargeable. So it's nice. It kind of sits on a little magnet and they charge nicely.
Wow, that's great. And do they have their USB, so you can charge them anywhere, right? Even in the car.
Yeah, you charge them. They all are connected to the back of the charger and have a USB plug. Some chargers are portable chargers, kind of like AirPods, that have the battery pack inside, so they can charge even without the plug on the go. But then you always have a basic charger that can plug in anywhere, anytime.
That's great. Very interesting.
And it's the battery life these days for hearing aids is so long. They last, give or take, I'm going to call it on an average of 20 hours or so, maybe a little bit more or less, depending on how much you stream from your cell phone. But 20 hours is most of your day. So, and then you charge them at night. And this way, when you're not using them anyway, that's a perfect time to let them sit and charge, and then they're ready to go for the day in the morning.
That's awesome. How water resistant are they? And I don't mean for swimming or anything, but just simply, oops, it started raining. I don't have an umbrella or a large rim hat or a sombrero from Mexico, or a dum-dum like me that'll get in the shower like once a month with his glasses on.
I think our rule of thumb tends to be that if you're getting soaked, the hearing aids are probably also getting soaked. So if it's lightly drizzling, more or less, they're probably okay. You might want to put on your hood as a protection mechanism, but you're probably fine. Eric, correct me if you think differently. But if you're getting drenched, I would put them away, and don't put them in your jeans pocket because they will end up in your washing machine. So make sure you put them in a safe space. Don't put them in your pocket. Don't put them in a tissue. They'll be in the garbage. They'll be in your laundry machine in no time. And then we do have people that who've jumped in a lake with them. They go in the shower with them. You're not alone when you said you went in the shower or have the potential of going in the shower. We've seen it all. Sometimes you get lucky and they still work just fine, and that's just a matter of good luck. And sometimes there's bad luck and they do break, but oftentimes they can be fixed. Either they're under a warranty or there might be some sort of cost, but they can be repaired. It's not a lost cause.
One thing we'll also that we'll say on that front is if devices are still in warranty, maybe you push the bounds a little bit more. But if your devices are out of warranty, you may want to be a bit more cautious in how you handle them around rain or sweat, moisture, things like that.
Do they sell extended warranties for those like they do for a lot of electronics these days? You know, it seems like even if I buy a little USB drive, the thing pops up on the payment terminal. Do you want to buy the 5-year thing for $100 for the $8 thing you just bought? It's like, what? You know, do they do? I would hope they would do that. They do it for TVs. They do it for they do it for everything now that's electronic.
So they actually do, but it might surprise you that we don't recommend them. And here's why. Hearing aids I should say, the hearing aids that you're going to get from a professional come with excellent warranties. They cover really everything, even things that are user faults. You go in the shower with them, your hearing aid's under warranty, the company's going to fix them. You drop your hearing aid in the toilet, the company's going to fix them. You jump in the pool with it, the company's going to fix them.
Wow.
Now, when your hearing aid is out of warranty and you get a repair, the whole device then would be under warranty for 6 months or a year, depending on what you choose.
Okay.
So if you're somebody who has not had a history of hearing aid problems, you're going to be paying for coverage that you're not benefiting from. So in our practice, it tends to be much more cost effective for patients who don't have a history of problems with their hearing aids to not bother with an extended warranty, but just pay for the repair when you need it and know that that device is going to be covered for another year.
That makes sense. I love that. Thanks. Have you ever heard of anyone becoming any sort of electric shock or just a little because of the water issue? No,
not once. But then again, we always think we've seen it all and we haven't. So you never know, but I don't expect it.
Okay, good. I wondered if there's any risk there when it comes to the water issue.
Eric, I don't know the worst you've ever seen. I think the worst I've ever seen has been either a dog eating part of it or somebody brought it in after it sat on the radiator. Probably one of those was the worst I've seen.
The radiator one was the one that I was thinking of. However, my mom was also an audiologist, and I don't think I'm making this up. I'm pretty sure she had somebody who ate one once and fished it out.
Wow. Wow, that's incredible.
That might be a repair that you take gloves, stick it in the bag, and warn the company on the paperwork.
Oh, God.
For sure.
This is a shitty situation.
Yeah, man. At least they found it. Being at the end of the year, I'd like to ask for each of you, share a couple like end of year recap stories briefly. Like, what is the craziest appointment you've tended to, whatever that means? What's the most common thing that you've addressed, not just real general, but like kind of a specific thing? And then I'll give you all time off until the rest of the year, till next year.
Eric, you had a good one from recently.
Which
about
one?
the processor and then the 2 hearing aids.
Oh, yes. So we had a really interesting case.
And I'll take the image off for people.
Okay.
We do a lot of work with cochlear implants, and those are for people who have really, really significant hearing loss that hearing aids are not sufficient for. And I had a patient who was implanted in another state. So there was an implant on one ear, a hearing aid on another ear, and it was just not working out. This was an older individual who I questioned whether the implant was a good idea. So we did some extra testing in our office. And what we actually wound up finding the best way for this person to hear was hearing aid, cochlear implant. So actually 3 different devices. So this is a case that I'll be presenting next year at a conference
Oh,
because it's not something that's typically done. And I've had success with two cases doing that, which is an unusual way of going about things.
interesting.
One thing that I do want to add that I think is really important for the end of the year, especially these days in the healthcare climate that we're in, where costs are so high and people really try and maximize the value with their health insurance. If you have met your deductible and you need health care, do whatever you can do to get it in before the end of the year and your deductibles reset.
Oh,
If you have not met your deductible yet and you have a higher deductible plan, you might want to wait until January if things are not an emergency, if it's just chronic care, routine care. Wait till January because whatever you do then would get applied to your new deductible early on in the year instead of having it apply to a deductible late in the year.
interesting. And the implant, does that work by picking up the vibrations off the bone? Is that how that works?
So those actually work by electrically stimulating the auditory nerve directly.
Oh,
Earlier in the show, we talked about those cells that get damaged from noise exposure.
yeah.
So the implant is functioning instead of those cells to stimulate the nerve.
Interesting.
Yeah, they're typically meant for people that hearing aids are not quite doing enough or not giving the patient enough benefit. So that's when we start considering a cochlear implant. In Eric's case, the patient is getting benefit from both the cochlear implant and hearing aids. So I was in the room when it happened. It was all his work, but it was fantastic to see the patient come more alive when he implemented this idea.
I was gonna say life-changing. It's life-changing when you can suddenly hear and realize how much you were not hearing. That was the biggest thing for me. I was just blown away. You just get used to your norm because it becomes so normal that when you can hear again, like when I was young and before I did all this damage, it was just amazing. Somewhat annoying in some cases, but yeah.
And I would say for me, I had two patients recently. I had two patients that both began crying in their appointments on the same day. One had a sudden loss. She woke up one morning and her hearing was gone. And the other patient had very, very minimal hearing loss, but it was affecting her in all sorts of situations at work, in social settings. She was starting to avoid going outside. And I think a lot of people dismissed that of either the hearing was just barely outside of normal. It was so mild, you can probably get by. But both of these patients began to cry in the appointments, and you have to hold their hand and hear them out and find your way to guide them. So being able to help them with hearing aids in such different situations, but both have positive outcomes, it's such a reminder of the importance of what we do.
I think it's also a reminder of how taken for granted it is often by people. And you have a podcast. That's how we met. Tell everyone about your podcast and where to follow you, and all that is in the notes, but tell everybody as well.
All right. So our podcast is called Hear Us Out. It's hosted by Eric and me. We explore how sound and hearing and music shape the human experience. We see the correlation of how live singing and music affects our ears and different musician preferences. We have healthcare professionals that talk about kind of what we talked about today about hearing preservation and the best mechanisms to manage tinnitus. We have vestibular professionals come on. We have people in the Broadway world talk about their experiences with live singing, wearing in-ear monitors. So we really have a nice wide range of people that come on the podcast. We just want to hear about the people who are in the best of their fields, talk about what their work is like and how they best serve their communities. So follow us on all podcast platforms. It's called Hear Us Out.
That's awesome. And lastly, on the topic of, that life-changing moment, Neil's chiming in again saying, but the program for kids I mentioned, I've seen children that have heard their parents for the first time.
Yeah.
It's an emotional experience. I don't know if people would have the same reaction if they heard their in-laws for the first time, but that's another story. And John Costello says, would be horrible to completely lose your hearing. Yeah.
Yeah.
Even aside from the enjoyment of music, just from the standpoint of losing such a major sense, that we have and not being able to communicate the same way. I just can't even imagine.
It's a really important point. We touched on it briefly before. It happens in about 1 in 100,000 people, but you can have a sudden hearing loss. It is a medical emergency because it requires quicker intervention to hopefully reverse it. It's not always reversible. Oftentimes it is, or improvement can be had, but it does require quick intervention. So if you experience a sudden change in your hearing loss, go see your healthcare professional. And when you look to schedule your appointment, say, I've experienced a sudden change in my hearing.
Is it more common that happens because of genetics or because exposure to something immediately or stress related or traumatic experience?
There are a variety of causes. Sometimes it's just not known that we can do a whole medical workup, have MRIs, have additional tests, and we don't know the underlying cause. We call that idiopathic when we don't know what caused it. But there are times where it could just be a virus inflamed the inner ear. It could be something vascular related to blood flow. It could be related to a nerve being compressed. That there are a whole lot of causes that it does require immediate medical intervention.
Great. One bonus last question. Tell us all, how often should we see an audiologist for a routine checkup, just like getting a physical?
We typically recommend coming in every 1 to 2 years. From the time we first see you, we probably say every couple of years, unless there's any reason to come in sooner. If you notice changes, if you notice the onset of tinnitus, if your doctor says you should come back sooner, if you have a family history of hearing loss, you might want to get checked sooner, but usually we would say on routine every 1 to 2 years, but much sooner if you notice a big change.
Great. Thanks so much for that. Thanks for everybody else who is watching. Thanks for all the comments and questions. We appreciate it. And you can follow Doctors Michelle and Eric in the links that are in the notes. Check out their podcast. It's great. And we'll see you all next year. Thanks, everybody.
Thank you.
Thank you.